Hi YouTube family, this is Miss K today. I'm alive. But this, as you can tell from the title, will be a breast surgery update. I did have my surgery and I'm so sorry you guys I haven't come in here to do an update, but I have been knocked flat. Well, not flat because I can't lay flat. But I have footage from the day of the surgery up until entering into the surgery center, because they said we couldn't film while when I went to the back for all my surgery stuff. And then I actually haven't looked at it, all of it. Guys, I have really been out, and I'm gonna go into the details of that, and my voice hasn't fully come back. It's in and out, but anyway, so we have that footage. I don't know what exactly he took after the surgery, because I was cuckoo for Cocoa Puffs. I was not with it. So, and I know I've talked something or said some things, but I'll go and look at it, and this will be my first real editing, so it's going to take a moment for me to edit stuff or whatever. But I did want to come in real quick and let you guys know. And I'm looking down because I have my phone. My dates are jumbled together, but I had my surgery, my breast reduction surgery, on January the 12th. My surgery time was 1 o'clock in the afternoon. I arrived there at 11:30. No, at 10:30. I arrived to the surgery center, and they had already told me, to wash myself the night before and again that morning. Nothing above the waist, no lotions or perfumes or anything like that. Wear a button-down shirt and something I could easily put on and off, which I don't remember putting on any clothes or anything like that afterwards. So kudos to the husband and nurse, I guess, that got me dressed. And it hurts to laugh too, you guys. And I'll just scan down a little bit because I'm at my station here. My husband sets me up before he leaves for work to make sure I have everything like within hand's reach, because I don't do a whole lot of up and down. And excuse the camera, I'm on this the webcam thing and not my actual handheld camcorder, which would be better, but it's easier. I could get that. The camcorder is out of my reach, and I can't reach up that high. I still don't have full range of motion. But anyway, I'm jumbling around. So I had my surgery on the 12th. It was a outpatient surgery, so I was home. I do know that it was dark, so it had to be around 7. I think the surgery was a little more than 5 hours. 1, 2, 3. Yeah, so around 7 o'clock I was home. It hurts. I'm not gonna sugarcoat this or anything like that. I know that I had a very good surgeon that's been very attentive to me, but I did not expect that kind of pain. I've had previous surgeries, but this one hurts, and it continues to hurt. And I know that I will have some. To me, you guys, there's a difference between hurting and discomfort. And everyone has their level of discomfort. I look at levels of pain like, if you pinch me, that hurts, that's painful. Discomfort is what I feel after the pinching and it's going away. Okay, I have pain, and I'm on hydrocodone, 7 milligrams of that Lortab. That's my pain medicine. I try just trying to wean myself off of that, and just, it's just going to be a healing process with my pain / discomfort. But as far as that's the only thing, I did have nausea right afterwards, which I knew I was going to. I told them ahead of time that I don't do well waking up. Usually it's, excuse me, dry heaving, but this came like the night of. I just slept. It had to be the next day. The next day it was just nausea, which I was couldn't. That hurts because using those muscles to dry heave, because I didn't have anything in my stomach, hurts your chest because you're using your chest muscles. But anyway, I was going to pan down, let you guys see that I started out as a 30. I think I was a 36, although some of my bras are 38. So I ranged between 36, 38, triple D, and F. One breast was a triple D and one breath. That's what my grandma used to call them, your breaths. Okay, I'm sorry, you guys. But anyway, and one breast was an F because it was spilling out of the triple D. But I don't know what I am now. Well, you guys can see. But oh God, it's and I have a sports bra on. I don't want to show too much, but I have a sports bra on. Let it get back into focus and straighten myself up. Oh, wait a minute. Oh, there you go. I feel so much better today, you guys. The other days, I couldn't even. First of all, I have a huge laptop, 17-inch laptop. I couldn't pick that up. So if I didn't remember to ask him to position this laptop, then I was out of luck. And I was in no situation, you guys, to update a video or show you guys anything. My hair, oh Lord, look at it. It's an absolute mess. But I'm recuperating. I feel better today. I'm able to laugh. And yesterday, my doctor, Dr. John Obi, OBI, he is thebomb.com. When I call you guys, because the only time it seemed like I have problems, of course, outside of the office hours, he is Johnny on the spot. I have directly his phone number. Yesterday I had to call because I started weeping from an incision, and I still had tape along my incision yesterday, and it was quite firm. That tape hadn't budged, and so that alarmed me because it was bright red, and I thought maybe I bust a stitch, had done too much, you know, whatever. And I called the office, and it was during office hours, so I was asking for the nurse because I know that he's busy. And I look like I got bags in my eye. Oh, anyway, I'm gonna have to cut this video because this is my first time on the video. I'm glad to be talking to somebody anyway. But yesterday my stitch was open, or I think it was open, and he said that that's where he expected it. If it was going to drain from anywhere, it was going to be at the anchor, or right in the middle of the incision of where he connected the nipple to the breast at the bottom, and that's exactly where it was bleeding from. And he said that if I wanted to come ahead and come in, I could. I did tell him that I was still on pain medication. He said, well, I don't think so because you're on the pain medication. Let's not take the chance. And so he talked me through to remove the tape and let it, you know, get exposed or whatever, and explained to him what was going on, and I was fine. Once I took that tape off, I've had better range of motion. I just feel better today. So I'm not going to keep going on because I'm going to give you guys more updates, but I just want to let you know that I did have my surgery. I think I'm going to be I might be a D cup. It's going to be between a C and a D. And I've gone through my emotional time about it with my husband. Like, oh my God, I look like I'm flat chested. But coming from how big I was, which you guys could see in that green shirt, down to not having boobs that fold over or droop down, it's like I just look at them like, what am I going to do with that? You know, I mean, what am I going to do with this? I actually can wear a tank top? A shelf bra? What is that? You just put it on and it sits in there, and it's like, oh. Anyway, but okay, you guys, I'm rambling. I want to thank everyone for your words of encouragement, your messages that you sent to me asking about me, your prayers, all that. I thank you so much. I'm appreciative. I do not take it lightly. I'm feeling good today. It's been a minute, because I don't see how women have this surgery and go to work the next week. I don't see it. If I'm a wimp, I'm a wimp. I'm a wimp, and I will say I'm a wimp, because I need every moment and more, because I could not imagine myself on my job right now, because of, you know, it's just the shooting pain, the discomfort. You still have incisions that are weeping and stuff. Like, why would you be on someone's job? But I guess if you had to. Now, I don't want to criticize anybody in there. You know, I don't know what their situation is, but if you had the opportunity to stay at home and be around family to take care of you and everything, you should take that time to get yourself healed up. Right now, my return date is February the 8th. So I still have a few weeks, and then I had a little setback too, so I don't know if that will affect my return back, because my setback was on the side where I had 2 drains. One side, I went back on Monday for my first follow-up, which was the 16th. And he took the drains out and everything looked okay. But then on Saturday or Sunday, it was either the 21st or the 22nd. It was Saturday. It was tender to the touch where the drain was taken out. I wasn't getting much drainage. It was hot. It was just very painful. So I called the doctor, and he answered, and he said that it could be a clot or something like that, and he called me in an antibiotic and told me to put hot compresses on it, and that did it. I mean, it was in a matter of like a 12-hour difference to where it's, you know, not painful to touch at all. I'm having some drainage, which is normal, which I called and asked about that. That's normal. So that was a little setback there. And so I go this Friday at 3 o'clock in the afternoon for my second follow-up visit, and I guess he'll take some more stitches out. I don't know, because I have stitches around my nipple, you know, and stuff like that. So okay, I'll have to cut this off, because I don't want to bore you guys or anything like that with the details and me rambling. But I'm gonna try and work on getting the hospital or the surgery center footage updated to show you on my way going to the hospital. I'm very excited. This is a new chapter, not having to deal with the spasms. I haven't had any spasms or back pains or anything like that related to heavy breasts, and that's just a weight lifted, literally, you know, and figuratively. I am just grateful and thankful. So I'm gonna cut this off here, you guys, because I can literally go on and on about every day and the little situation that I've had. I'm gonna come back in and talk more about it, but I am working on getting you guys the video uploaded of me going to the surgery center up until me having to turn the camera off, and then afterwards, and then I'll come back with just updates of, you know, daily updates of what I've been going through, recuperating from the surgery. So I am now probably a 36, 38 C or D cup, and I'm grateful and I'm thankful. All right, you guys, I'm gonna go. Bye.